Welcome back to another episode of Black Health. I am your host, Dr. Michelle Kirwan Bythewood, board certified pediatrician and chief medical officer of a health center in Miami Gardens, Florida. And one thing that I've noticed in my many years of practice is that our oral health often takes a backseat to our medical health. And this is not because people don't care, but rather often due to barriers to care. And that's the focus of our show today, oral health, and in particular, oral health equity. And we are joined by Dr. Richard Lipscomb Jr. to lead this discussion. Dr. Lipscomb is a general dentist. He did his dental degree at Howard University School of Dentistry and serves as the dental director of the Teaching Health Center of Community Health of South Florida. He's an international speaker and lecturer. Welcome to the show, Dr. Richard Lipscomb. Thank you for joining us today. There you are.
Hi, thank you for having me.
Absolutely. We're excited. I'm excited to talk about this topic. I feel like it's one that is underrepresented in our general health care. So let's start with a little bit about yourself and what inspires you to address oral health equity, especially in the Black community.
Well, I've been practicing general dentistry for over 32 years in both private practice and community health center environments. And I just have the luxury of being able to compare different sets of populations as they um, receive dental care. Um, in private practice, you have less of a problem in terms of access to care. You have adequate and stable insurances and income. And in the community health center environment, in these underserved areas, you don't have those things. So over the years, I've been able to see uh, good things and bad things involving the equities of health for different populations.
So when we talk about oral health equity, what does that mean in particular? What does that mean in practical terms?
So for me, I feel like the two biggest challenges for equity in healthcare is or oral healthcare is access to that care and the ability to afford the services that are being provided. A lot of times, the access is just so great that patients can't get services that they want. And same thing with the affordability of that care. Patients just don't have the income to meet the needs or to pay for the services that they need.
What is the state of oral health in general for the African American population in the US? What does that look like right now?
Well, there have been some improvements in terms of being able to gain access to oral health for the Black community. However, there still are very great gaps in terms of the disparities between Black Americans and their health care or oral health care versus other ethnic groups in a community. For instance, loss of teeth, untreated caries or dental decay, periodontal disease. These are disparities that exist and have existed over a long period of time.
So why do Black Americans have higher rates of untreated dental caries, gum disease, compared to other races and ethnicities in the United States? I know you mentioned some of the barriers. Are there, what do you see as the overall picture, from starting maybe from childhood to adulthood? Why do we see this more in our population?
I think a lot of it has to do with money, whether it's the income that a community is able to produce to get these services, falling back on access to service, access to care. Um, it's a big difference when you have the ability to pay for services as opposed to not. Also, the coverage, insurance coverage. A lot of Black communities, the population is depending on Medicaid and Medicare for their services to pay for the dental services. And with Medicaid, it only basically services the young, children under 18, as opposed to Medicare that doesn't have any adult coverages as far as dental is concerned. So those are things that really hamper Black communities in terms of getting the adequate care that they need.
What about education, what we call health literacy? Do you feel like there's enough education in the Black community about the importance? And we'll talk a little bit later about the health problems, the systemic health problems that poor dentition can lead to. But do you think there's enough health literacy in the Black community as to the importance of our teeth, and especially the importance of including, I should say, the importance of the baby teeth?
No, there isn't. There needs to be a lot more education because there are still ideas out there that just aren't correct in terms of our dental health and how our Black communities feel about teeth in general. Um, there's oftentimes people that come in that we see or just saying, "Hey, take all my teeth out; they're so painful," or "Take them all out because I don't like the way they look." And those are things that still exist in terms of as patients come in and as we treat them.
So, you see children, right? You do general dentistry, so you see children. What do you see of parents? As a pediatrician, what I see often is I'm telling parents you can go to the dentist from first teeth, from the first two teeth that come out. It's just a quick visit, a oral hygiene visit, how you take care of the teeth and the importance and so on. Do you see many parents that come at those first two teeth? Or I know back when I first started practicing, we were told 3 years of age, and I've heard the age kind of drop. But what about the younger children? Are you seeing them? Are you seeing the education in the community, in the Black community, regarding the importance of getting to those baby teeth from an early age?
I think it's getting better because you're right. Early on, it was okay, 3 to 2 years, and that's generally too late. I suggest, and most people go by whenever they have two teeth, whether that's by age 1 or 11 months, 10 months, it varies depending on the person. But if they have two teeth, they have the ability to collect bacteria, collect plaque, and start the decay process of their teeth. So we want to make sure that we start early. Two teeth, like you said, very simple, quick, easy appointments that aren't traumatizing to the patients so that they're wanting to come back, making those appointments quick, fun, and but also educational, not just to the kids at that point, but more importantly to the parents because they're the ones that are going to be implementing this home care regiment, and they're going to be the ones that are going to be staying on top of the kids, making sure things are getting done. So again, suggesting by the time when they get two teeth, that's when they should be seen by the dentist.
And, I think it's important for patients to see dentists and doctors that look like them. I think that's important for the Black community. Fewer than 4% of US dentists identify as Black. And I think that impacts oral health care. Do you?
Yes, I do. I never realized when I saw that stat that it was so low. And what that means is that, especially in the Black community, when trust is a big issue, and if you have providers and dentists that look like you and understand your situation a little bit better than others, then you have a better chance of being able to not only treat these patients, but also gain their trust so that they understand as you're trying to educate them about their oral health and getting them into a better place.
So, Dr. Lipscomb, we talked a little bit about the social determinants of health, education, access to healthcare, the cost of dental care. Talked a little bit about racism. There's also the political determinants of health. And there's been a lot of talk recently about removing fluoride from the water in Florida. And it was a political thing. What health impact does that have, or will that have?
Well, I'll try to stay on the non-political side of it because fluoride is a big issue. It's a big hotspot in terms of not just dentists but other researchers. And the problem is that fluoride by itself in studies isn't consistent in terms of how it impacts a community. You have some communities that have fluoride, but yet they have high rates of untreated caries. You have some communities that don't have fluoride and have a low rate of caries. So that's where kind of the problem lies. And so with those things in place and those studies out there, we look towards other means or other factors that determine the amount of decay in a particular community. And those things are education, making sure that they understand that you have to have good home care to prevent cavities. You have to have regular checkups. And in those cases where there's no fluoride, having more checkups or regularly periodic checkups is recommended, along with supplements, fluoride supplements, And just again, just making sure that you have the opportunity to be seen by dentists more frequently than other areas that don't have fluoride.
Thank you for that, Dr. Lipscomb. We do need to take a quick commercial break. You are watching Black Health. We are talking to Dr. Richard Lipscomb, and we are talking about oral health equity. We'll be right back. Don't go anywhere.
Welcome to the city of Miami Gardens, where purpose meets opportunity. From building tomorrow's infrastructure, to answering the call when it matters most, to creating vibrant spaces and smart growth, every role counts. With 4-day work weeks, 100% paid health benefits, generous PTO, and a Florida pension plan, the city of Miami Gardens puts you first. Join the team that's shaping the future.
So we know that breast cancer can affect everyone, but why is early detection for Black women so critical? It is so critical because Black women have a higher mortality rate, so they are 40% more likely to die of breast cancer compared to their Caucasian counterparts. In addition, Black women are often diagnosed with more aggressive phenotypes of breast cancer, such as triple-negative breast cancer, which can be harder to treat. Lastly, Black women are often diagnosed at later stages, when it is harder to treat and survival outcomes are lower. So it's important to listen to your body. It's important to educate the community, to educate the population so that Black women know what the early warning signs are, which can lead to an earlier diagnosis and improve outcomes.
Early detection can save your life. Book your mammogram today.
I grew up down here in South Florida, so for me, it's a little bit more personal.
For the Mesman and Dover Law Firm, it's about community.
For us, South Florida's our home. You all are our people.
Our family, our future.
The difference we'll make for you, your loved ones, your kids, matters, because to us, it's personal.
If you need us, call us 24/7 at 866-954-MORE.
That's 866-954-6673. Demesman and Dover Law Firm, youraccidentattorneys.com.
I'm Eileen Higgins, and I'm running to serve as your next Miami mayor, but with a clear plan. Invest in more housing so that residents can afford to live here. Strengthen public safety so residents and visitors feel safe. Clean up our parks so families have green spaces to enjoy. And restore transparency so people can trust their government. As your mayor, we'll get things done. Miami, this is our time.
Welcome back. You're watching Black Health. We are talking about oral health equity, dental care with Dr. Richard Lipscomb. Dr. Lipscomb, what laws or policy changes could make the biggest difference right now in dental health, in oral health care for our community?
Well, I mentioned it before in terms of Medicaid and Medicare. Medicaid, that you have benefits for the young and children, and Medicare, adults that you don't have any dental services. So with Medicaid, children's usually, for the most part, can take advantage of those benefits and those services. But the problem is once they age out of those programs, where are they to go? And they just lose any kind of dental insurance or in dental coverage for them as they enter adulthood. So that's, I think, is a big issue. And I don't understand why, because Medicare, it serves medically for these patients, but it doesn't make sense that it doesn't cover any dental services at all.
And especially with potential upcoming changes to Medicaid and Medicare, the situation could definitely change if less Americans have coverage for both. What is being done to connect the underserved population to care? You talked about community health centers around the country helping the plight of dental care for the Black population. What does that look like? Go into a little bit about, you spoke a little bit about community health of South Florida, but if you don't have insurance, what does that look like? Do you have mobile dentistry? Are there other ways of getting to the community that can assist the community, the underserved community?
So just like medical, you have to really go to the problems and you have to go to the community if you're going to try to change things. In dentistry, there are ways, as I mentioned, about community health centers, and they are organizations that are in the community, work with the communities, not only their presence, but they also have outreach programs. They have health fairs to enable patients to know about their services and not just hear that they're there. They also have, as you mentioned, mobile services. They have our organization has a mobile van. We're able to reach several communities on a monthly basis, and not just the one that the organization's in. We're able to give those services to school-based programs and other hard-to-reach areas that normally are not given access to dental care.
We have a mobile program also. We don't do dentistry just yet on our mobile unit, but I think that it's an amazing thing to be able to take dental care out into the community. So, what exactly do you all do on your mobile unit? So, I don't imagine you're doing extractions or fillings. I mean, unless you have all the equipment on board, I don't know. But what types of services do you take out in your mobile unit to the community?
Well, actually, no, that can be done. We have a full service mobile
Really?
unit. For the most part,
Okay.
though, we use it for school-based programs where we have a hygienist and they go to the schools, they do screenings, they do sealants and cleanings. But we also have dentists who actually work on the van and perform routine dental dental procedures, extractions, simple fillings, and even dentures and partials if need be.
So you have the real mobile clinic,
Yes, we do.
dental mobile clinic. We have a mobile clinic that we kind of, are going to try to do a little bit of minor dentistry on it, at least to start off until we get our next mobile unit. That's amazing. I think
Yeah,
that's
and
amazing
it
that those
does
types of
help. It,
services
it
can
just
go.
allows another way to deliver dental care and trying to combat the barrier of access because we all know the patients are there. It's never a short of the patients that need dental care. That's not an issue. The issue
Yeah.
is how are we going to get to these patients? And if you don't go to them, it's hard for them to come to you. It's very hard. So that's one of the ways that we try to help out.
So another way that you can get to a patient without the patient having to come to you is by what we call telehealth in the medical field, and I think you all call teledentistry. What does that look like? What can be done via teledentistry, virtual visits?
So these virtual visits can be done and help in terms of using them for dental services or dental appointments. It's the same way. Typically, patients will log in into some type of phone or computer so that there is a visual image of those patients and the doctor. So there's a connection that way. But also for dentistry, it's a little bit different because we can't actually treat patients, and that's what our big thing is seeing patients, getting into their mouths and doing our work. But with telehealth, we have to take a different approach, and that is at least having conversations with the patient, trying to figure out what those symptoms are, and sometimes getting a visual in terms of what their mouth may look like, so that we can have some idea of what direction we can advise these patients to take. And then once we have that, then we can circle back, have staff contact these patients, make appointments, and at that point, at least we know, have some idea of what's going on with them so that when they get to the office, we have x-rays to take to confirm any kind of diagnosis and start treatment right away. I think the biggest thing is just making that connection and making those patients comfortable and letting them know, like, hey, we understand you have a problem. We're here to help. Let's give me some idea of what that problem is so I can direct you in the right direction.
And does Community Health of South Florida provide transportation for patients?
Yes, we do, not only for dental, but medical as well.
Yeah. So I want to spend a few minutes talking about why oral healthcare, dental healthcare is important in terms of the rest of your body, because I think many people believe it's just the teeth. It's the baby teeth. They'll get new ones. It's, just take them all out, like you said. What about how our oral health leads to systemic illness? What's the effect with heart disease, strokes, diabetes, pregnancy, infections, inflammation in the mouth? Talk to me a little bit about where that can go to. But actually, I'm going to put a pin in it real quick because we do need to take another commercial break. You're watching Black Health with Dr. Richard Lipscomb and myself, Dr. Michelle Kirwan Bythewood. We're talking about oral health care and oral health equity. We'll be right back.
Welcome to the City of Miami Gardens, where purpose meets opportunity. From building tomorrow's infrastructure to answering the call when it matters most, to creating vibrant spaces and smart growth, every role counts. With 4-day work weeks, 100% paid health benefits, generous PTO, and a Florida pension plan, the City of Miami Gardens puts you first. Join the team that's shaping the future.
So we know that breast cancer can affect everyone, but why is early detection for Black women so critical? It is so critical because Black women have a higher mortality rate, so they are 40% more likely to die of breast cancer compared to their Caucasian counterparts. In addition, Black women are often diagnosed with more aggressive phenotypes of breast cancer, such as triple-negative breast cancer, which can be harder to treat. Lastly, Black women are often diagnosed at later stages, when it is harder to treat and survival outcomes are lower. So it's important to listen to your body. It's important to educate the community, to educate the population so that Black women know what the early warning signs are, which can lead to an earlier diagnosis and improve outcomes.
Early detection can save your life. Book your mammogram today.
I grew up down here in South Florida, so for me, it's a little bit more personal.
For the Mesman and Dover Law Firm, it's about community.
For us, South Florida's our home. You all are our people.
Our family, our future.
The difference we'll make for you, your loved ones, your kids, matters, because to us, it's personal.
If you need us, call us 24/7 at 866-954-MORE.
That's 866-954-6673. The Mesman and Dover Law Firm, youraccidentattorneys.com.
I'm Eileen Higgins, and I'm running to serve as your next Miami mayor, but with a clear plan. Invest in more housing so that residents can afford to live here. Strengthen public safety so residents and visitors feel safe. Clean up our parks so families have green spaces to enjoy. And restore transparency so people can trust their government. As your mayor, we'll get things done. Miami, this is our time.
Welcome back to Black Health. We are talking about oral health equity with Dr. Richard Lipscomb. Dr. Lipscomb, we only have a few minutes left, so I just want you to give us a nutshell of how oral health impacts the rest of our health.
So with oral health, when you have poor oral health, basically you have an overload of bacteria that not only affects your teeth, your gums, but it also affects your overall health and systems, which can lead to acute and chronic inflammation and infections in other parts of your body, and also affect either pre-existing conditions and also initiate conditions that you may not even have. And so that's why it's so important that you have good oral health, because you want to make sure that you're lowering or trying to decrease the amount of bacteria flowing, not just in your mouth, but in your entire body. Because everything is
And I
connected.
believe it can complicate pregnancy also, right? Leading to
Yeah.
low birth weight and preterm deliveries.
Yes, it can do that.
And I believe it's also linked to cognitive decline, if I'm correct. There's a link between cognitive decline and oral health care.
Yes, there are studies out there that show that. And again, this the biggest thing is just trying to make sure that you're minimizing the amount of bacteria by having better oral care. And again, we talked about this before. It's about the education and being able to trust the information that you're getting from these dentists or from the providers.
Two last questions for you, Dr. Lipscomb. For listeners who are listening out there who may not get regular dental care, what are some practical steps they can do to protect their oral health at home? And if we were to achieve oral health equity in this country, what does that look like to you?
So if you have limited access, the things that you can do at home is, one, develop a great routine in terms of flossing. That is like one of the biggest things that people don't like to do, but yet it's the most impactful in terms of trying to reduce the amount of untreated caries that we have and that develops in the community. So flossing and just making sure that you're brushing. And I know that sounds crazy, but a lot of people don't brush their teeth. They say, okay, I brush it once in the morning and then that's it. And that's just not enough. So flossing and brushing more often, those are the key things to make sure that if you have limited access, that would go a long way in terms of trying to stabilize your oral health. And the other
And
question,
what does oral health equity look like to you? If we were to achieve it in this country, what does that look like?
I think that increasing the amount of Black providers in our Black communities would definitely increase the accessibility of this treatment to the community. So, access to the services and also just affordability. It's just our communities are just can be or have low income, and that's just not going to cut it when you're wanting services that are costly.
And Dr. Lipscomb, for those that have been listening and saying, this is a passionate dentist, he loves what he does, he cares about his community, how can they find you?
They can find me. I work full time at Community Health of South Florida Community Health Center. Right now, we are in the process of developing our dental residency program, but in the meantime, I'm working full time seeing patients. Uh, we have several sites that provide dental services. Look us up on the web, and I'm always here.
And any final last words for our audience? Any words of encouragement?
I just appreciate the opportunity to talk and give dental a space to be heard. A lot of times, medical just overshouted, and we don't get the opportunity. So whether it's a health fair or at a community health center, we always try to make sure that we're in there trying to fight the fight to make sure that people are trying to take care of their teeth as best they can.
Well, we thank you. The community thanks you. I thank you for coming on Black Health today. It's always a pleasure to have guests. For me, it's particularly important to address oral health care because I do feel like it takes a back seat to medical care. And we really have to take care of the entire person, the entire body, oral health care, medical health care, mental health care. And so I try to, promote all of these on Black Health so that people listening understand that everything is equal. If your mental health is not good, then it affects the rest of your health, and it's the same for oral health care as well. So I thank you, Dr. Lipscomb, for being so passionate about what you do and being a part of Black Health today. And I am Dr. Michelle Kirwan Bythewood, your host. You can find me on Instagram at Black Health Show. You can find Dr. Richard Lipscomb at the Community Health of South Florida. And we will see you next time on Black Health. Bye, everybody. Thank you.